We begin tonight with an urgent call to hire more nurses to staff the sexual assault domestic violence unit at St. Catharines General Hospital.
Niagara Sexual Assault Centre says several survivors have been turned away because of staffing shortages. Manisa Danabalan is live with more. Manisa?
Phil, the organization says the unit, also known as the SADV, is supposed to run 24/7, but it's only staffed 50% of the time. And victims are either turned away and told to come the next day or told to go to Hamilton or Burlington. We're also hearing tonight that this isn't new. Tricia Cosgrove from the Niagara Sexual Assault Centre says the SADV unit at St. Catharines General Hospital is the only one in Niagara region where victims can access testing that could be used for evidence. But there isn't enough staff, an issue they raised 7 years ago.
The SADV shares the nursing schedule with us. And so we see the lack of staff, unfortunately. And we also get calls from survivors that say, I went to the hospital, no one was there.
She says asking them to come the next day or to go to a different location can cause more trauma and complications.
Some drugs that are essential for people in this situation, whether it be antiretroviral medication, whether it be Plan B, those have to be administered in a specific time frame. So you cannot have that after, I believe, 72 hours. And also on top of that, there's always the evidence degradation. They have to be taken within a very short turnaround time. Some are 24 hours, some are 72 hours, and that's only if you do not shower.
In a statement, Niagara Health says, unfortunately, we have had long-standing staffing pressures that have been exacerbated by the pandemic, resulting in times when we are unable to provide this service on a 24/7 basis. We are very sorry for the difficulties. We are actively working to recruit nurses to this program and looking at expanding the service to a region-wide mobile response model. St. Catharines MPP Jenny Stevens says victims being turned away is horrific, and the Ontario government should take action.
Ford government has stripped the nurses the rights to bargain, a fair bargain for wages. With Bill 124, we need to repeal that, as well as what we need to do is to make sure that there is hiring of nurses throughout Ontario.
But Cosgrove says several other SADV units in Ontario are not experiencing a staffing problem.
They may have some days that they might have, a shortage of specific staff, but not at this level.
The Niagara Sexual Assault Centre says they appreciate all the hard work from the nurses and understand that there is a staffing problem, but this is a crucial service and Niagara Health needs to hire more nurses as soon as possible. The Assault Centre provides a 24-hour crisis line as well as other services and resources for survivors. Details can be accessed on their website at niagarasexualassaultcentre.com.